changing lives in New Jersey. We are with our town hall addressing the Latinx communities in the state, presented by the New Jersey Department of Health COVID vaccine. My name is Amanda Medina-Forrester. I'm the Executive Director for the Department of Health, Office of Minority and Multicultural Health, and I'll be moderating this town hall presentation. With us today, we have Dr. Marcella Perez. She's a board-certified family medicine physician at Zufall Health at Morristown, New Jersey. We also have Dr. Gina Miranda Diaz, a board-certified advanced practice public health nurse, and she's also the CEO of Hudson Consultants. And we also have Dr. Louise Espina, our board-certified family practice physician with RWJBarnabas Health Medical Group. So thank you, everybody, for being here with me today. I'm really looking forward to our conversation. So I'll start with our first question. So our first question comes from Dorila from Clifton, and this is for Dr. Diaz, Gina. How can we approach the Latino communities and make them understand the importance of receiving the vaccine?
Well, I think one of the first steps is to assess. Do an assessment, find out what they know, where they're getting their information from, and provide them information that's easy to understand, that is accurate, and involve stakeholders in the community. It could be your local community, your clinic, your medical home, wherever they go to get their health care, and even go into the community. Sometimes we have to think outside of the box, maybe going to barbershops, beauty parlors, nail salons, and just speaking to people in terms of they understand and asking them to give you and to relate to you what are their fears and what are their concerns and what do they know about the vaccine. And make sure they stay away from unscientific sources such as Instagram, Twitter, and Facebook.
Mm-hmm. Thank you so much. So this question goes to Dr. Perez. This is from Enid from Newark. Can you please share with us the side effects thus far that we have already known about the vaccine?
Yeah. So the most common side effects reported are definitely injection site reactions, so a little bit of soreness in your arm, depending on which arm you've received it in. You can also have some fever, body aches, some fatigue, okay? Those are the most common side effects, and they usually last 1 to 2 days. We're advising patients that if they do get some of these side effects, it's perfectly okay to take a little bit of Tylenol, a little bit of ibuprofen, either medications that you can take. But they are very normal, and it just means that your body is making antibodies, and that's what we wanted to do. Personally, I just received my second dose this week, and I did have a little bit of arm soreness and a little bit of fatigue. That was 2 days ago, and today I feel 100% fine. So there's some people that get no side effects, and there's others that get a little bit more mild, but again, these are all expected and very normal.
Mm.
Yes, I agree. I got the same. I also received my second dose on February 3rd. And yeah, it was painful, but I felt so much better after having had the second dose. It's really, you feel a little bit more relaxed.
Yeah, I bet. Thank you, Dr. Diaz. Dr. Espina, what can happen to you if you unknowingly have the virus and you have to get the vaccine?
So if we're referring to somebody who's asymptomatic, but if you had tested them, you would find out that they're positive. In reality, you shouldn't expect anything really different. You might have a little bit more of the side effects that Dr. Perez refers to, just because your immune system's already responding. So in some patients that have had the virus before they got the vaccine, they've had a little bit more of the malaise, a little bit more of the temperature elevation. But in reality, as far as serious side effects, nothing of any significance. It would just be you're already making the antibodies if you have the infection currently, so now you're going to make a little bit more. It's the vaccine's only giving you a little piece of the instructions to make a little protein that's on the surface of the virus, which is what's triggering the immune response. It's triggering the antibody creation. So if you have it at that moment, it's not really going to change anything. Maybe a little bit more symptom, but that's a huge maybe. I got both doses of the vaccine, and I guess my immune system's ready to give up on me already because I didn't have any side effects at all. I just, I didn't feel anything.
Lucky.
So that's it. I might be halfway out already.
Great, thank you. So this question's for Gina. So Marlene from Trenton asked, Latinos have a bad history with this medical experimentation on them. So why should they trust the science now?
Well, I did investigate that. I've only heard of a few of these historically unethical experiments and unethical research. Most of what I've seen in the literature is that Latinos will often feel, if they're in a research study, that they still have a patient, doctor, sort of that they're overseeing them, or that they have to sort of do it. It's sort of an obligation, or they're not really sure what's going to happen to them. If they have a family member, though, or a friend, they're more likely to join a clinical medical research. But as before I was reading that actually a lot of Latinos had participated in the research study for the COVID vaccine, for both of them. And while we represent in the United States about 17.6%, I think they said, of the population for 16 and older and Latinos, there were like 20 and 23% Latinos in these clinical trials. So that was an excellent representation of our population, and things are a lot different now. We have people overseeing the entire research study.
Mm.
Make sure that it's ethical. Yes, Dr. Perez. Sorry.
And just to add to that, I think for that reason, when I came across the opportunity to participate in the phase 3 Moderna clinical trial, I think that's one of the reasons, too, that I wanted to join, to make sure, one, that Latinas, Latinos were represented in these trials, and two, I think from my perspective, to be able to really speak to patients, and have you guys, if I can talk to my patients about my experience through the trial, that I trust science, and I feel that, we should come across and let our patients know that they should trust science too. There's no conspiracy, no one's out to get us. I think Latinos and African Americans have been disproportionately affected by COVID-19 and by this pandemic. And so I think, there's a lot of research and there's a ton of great evidence that these vaccines are effective, and we need to make sure that our community understands that, and that, they're just here to help, and, that's what we're trying to do.
Yeah, thank you, Dr. Perez. This kind of goes to the question for all of you. We have a great question from Denise from Pensacola. So how do we even encourage more Latinos to get the vaccine? What messages should we be giving them?
Guilt works well. So, if you don't want abuelita to get sick, if you don't want mommy to get sick, if you keep yourself healthy by getting vaccinated, and all joking aside, the great big push for this vaccine is basically, we're now hearing about all these mutations that are happening around the world. The mutations are happening because the virus is able to replicate in everybody that it infects. And the only way to stop that process, the mutations can be very benign or it can be much worse than the virus we're dealing with right now. So that's a mysterious little cavern we don't want to explore. The way to stop that process is to get everybody vaccinated. The more everyone is vaccinated, the less opportunity the virus has to replicate, and the less opportunity that it has to mutate into something even more dangerous than it is already. So I use that, and again, keep your family safe. You vaccinate not just for yourself, you vaccinate to protect those around you. Same as wearing a mask. These are all things to protect each other. It's just basic public health.
Yeah,
I agree. And when you tell them that you've gotten the vaccine, you seem to have a little bit more credibility, and you can tell them what your experience was like, and they can ask you questions and maybe have a little bit of better comfort level.
Mhm. And to add to that, we had a question about our older generation who are Latinos. What would you do? How would you educate them?
I think, as professionals in the medical field too, I think it's probably, at the very beginning of the pandemic, we were trying to educate people about this public health and what to do with COVID. And I think now it's kind of shifting, and, it's our primary job to really talk to patients. So I think if anyone's hesitant and even are older, I would encourage you to talk to your doctor. That's why we're here, your primary care doctor. Tell them what your concerns are. Tell them what your fears are. So I think it starts there. If you have questions, go to someone that is knowledgeable, someone that's an expert. I definitely would say stay away from misinformation. So, and with that, if you see misinformation, don't keep spreading it. I think that's another thing that we should be telling our patients. If you got the vaccine and you had a good experience, tell your family and friends, because like Dr. Diaz said, if when I tell my patients I got the vaccine, I'm doing well, our patients are all doing well, I think they feel better about that. So even within our own community, we should be encouraging each other to get the vaccine and helping to stop some of that misinformation that's going around. And definitely don't propagate it yourself if you're not an expert and don't know if it's true or not. So.
Mm-hmm. No, thank you. To add to another group. Oh, go ahead,
Yeah,
Dr.
just to add to that, Dr. Perez, the World Health Organization identified the Twitter, the Instagram, this misinformation as the infodemic. And so I have been getting things texted to me or emailed to me from people saying, look what this person said. And the other day I reported one of them to Facebook, and some other person just recently had their Instagram post brought down. So when we see bad information, when we become aware of it, nip it in the bud, report it.
Yeah, thank you. Thank you for that. So Lenny from Woodbury has a good question here about undocumented residents of New Jersey. What efforts can we do to assist undocumented Latinos to getting the vaccine? Gina, would you like to?
Yes, the new administration has a very different tact in terms of dealing with and embracing undocumented individuals in this country. And so they are not allowing and are assuring folks that they will not be federal agents there to take them and to anybody from immigration to be there or near any of the vaccination sites. So that should give them a level of comfort. But we need to make sure that information gets to the stakeholders in the community, people that they trust. Dr. Perez and her clinic, or Dr. Espina, to get that point across, because people are very fearful. And it would be a shame if they have access to this vaccine that's free, and they're fearful of getting it because they're afraid of immigration, their immigration status. In addition to which, they can also continue to spread it in their homes. Latinos are very high risk for COVID, and they have a very high and disproportionate number of hospitalizations and deaths. So we have to really get that message across. And I think local stakeholders and people in the community are the best way to go. Churches, your pastors, whoever you can get to bring that across to folks.
Yeah, thank you, Dr. Diaz. Dr. Perez?
Yeah, so I also wanted to make a plug here for what we call FQHCs, and those are federally qualified health centers. And there are many across New Jersey. And so I also encourage patients, to look for the federally qualified health center in their area. It has the word federal in the title, but, we're not tied to we get a lot of funds from the government, but we're not tied to them. We don't report. And, out of the patients that my federally qualified health center serves, about 50% of our patients are undocumented, and about 2/3 of our patients are Latinos. And so, these are the people that we're vaccinating. And so I encourage everybody to, if you don't have a primary health care provider, to search for a federally qualified health center. Again, we take patients that don't have insurance. We don't ask for a lot of documentation. We just ask for an ID. But those are places and good resources that you can, develop a good relationship with a primary care physician or provider. And, that's another way we're going to be vaccinating a lot of people across the state. So it's a good resource, and I encourage everybody, if you don't have one, to look for one near you.
Yeah, and thank you so much, Dr. Perez. Dr. Espina?
Yeah, and not just related to the vaccine. There's a lot of fear with getting help when people are actually getting sick. They're so worried about immigration status that by the time they show up at the emergency room, unfortunately, many times it's too late. So I beg of people, reach out to all of us. We're here to help. I'm going to ask you 87,000 questions. The last thing I'm going to ask you is anything about immigration status. I could care less.
Yeah.
The only thing I'm interested in is figuring out how to help you. So please don't wait to get help. Don't wait to get vaccinated. Find one of us. We're here to help.
Yes, thank you for saying that. At the Department of Health, we're very strongly an advocate for don't ask for immigration status. When you go to a points of dispensing, no ID is required. Make it simple for the resident. Allow language interpreters, translation services, and of course, everything being translated in different languages. So there's a lot of steps that I think all of us are taking to ensure that our residents are protected in every which way. So thank you for that. In regards to the vaccine, there is a couple of medical questions I would like to ask you. So Vincent from East Windsor asked, does the vaccine interact with any prescribed medications? And should I stop taking the medications before I get vaccinated? So Dr. Espina, would you like to take that one?
Sure. No and no. No interaction. And please, for the love of God, keep taking your medications. If there's anything, if you're very immunocompromised or you're under some type of therapy for some conditions, like there's some infusions for multiple sclerosis, some things in chemotherapies, what you should do in the first place is talk to your specialist who's prescribing these medications. But from what I've seen thus far, nothing. As far as diabetes, hypertension, heart disease, there are no problems with the vaccine and the medications. Please continue taking your medications, including the day you go get the vaccine. Don't do I was going to get the vaccine, so I didn't take the medication. Take your medication, always.
Thank you. Thank you for that. So to add to that, Dr. Diaz, Ana Maria from Hillsborough asks, what are the side effects if you have comorbidities or several comorbidities?
They're the same. I have not seen any literature that says that, if you have these comorbidities, it's going to be worse. But as Dr. Espina said, I want to echo what he said. If you're immunosuppressed, if you're taking steroids or any kind of medication, or you have any other comorbidity where you're immunocompromised, you would definitely speak to your physician. But as far as I know, and as far as the literature shows, there is no comorbidities do not affect your ability to get the COVID vaccine.
Thank you, Dr. Diaz. And this kind of asks another question about diabetes. Ora from Fairlawn asked, are people with type 1 diabetes eligible to receive the vaccine? So with Dr.
Yes.
Yes.
Yes. The answer is yes. I can't say yes strongly enough. Yes. Please get the vaccine.
Thank you. So I have a question about the J&J vaccine that has not been released yet. So from Wayne in Hamilton. So Dr. Espina, what's the status of the J&J COVID vaccine?
So the FDA, these vaccines are being released under something called an EUA, or an emergency use authorization. And the FDA, from the last that I read this morning, They'll be having the meeting at the end of the month, February 26th. They'll review the data, ensure that the validation data, the testing, everything is as it should be. And then from there, they roll it out. How soon that'll be on the street? I've heard things on the news, just like you have, that, you know, there's all these doses are already manufactured and ready to roll out. So hopefully it'll be quick. But the thing is what I stress to everybody. So before I became a physician, I used to work as an engineer in medical devices. These companies are very careful and very precise in how they do these things. So I have great confidence in their ability to not only roll it out smoothly and quickly, but accurately and safely. And, you know, so that means that February 26th, it doesn't mean February 27th you're going to have the vaccine, but you'll have it pretty quick. They're really doing an amazing job when you see just how much has happened in the last year. It's incredible.
Great. Thank you. Does anybody want to add to the Pfizer and the Moderna other pieces of if the J&J does come, will the other vaccines also be rolled out? I mean, not rolled out, but they'll also be as abundant supply as the J&J? Or what?
And we would hope so. I know that they're developing these. It's actually companies are getting together. They're not just in one place. They're making this particular vaccine. One of the benefits people believe of the Johnson & Johnson is that it's a one and done. It's one dose and you're done with it. And I think that's great for compliance in the compliance factor, because I've spoken to some folks and they were like, well, my friend's not getting the second dose, a Latina. She says, because he doesn't know if the first one worked. And why does he have to get a second one? And why are you still wearing a mask? So I think for, you know, with the compliance level of the second dose, it may be very advantageous for individuals to get one dose and at least have that protection.
Mm-hmm. Thank you. That's a great point. To add to the education, not in addition to the vaccine, you had touched upon wearing a mask. So the question I have from Wayne in Hamilton, can one stop wearing a mask after I get vaccinated on my second shot?
No, you cannot, because we don't know. It's still new. You remember Dr. Espina alluded to the emergency authorization. Is it safe? Use authorization, actually. It's safe and it's effective, but we don't know enough about how effective is it in the long term. And it doesn't prevent infection. It helps you if you, with symptoms between 95% up to 95% effectiveness. So you still have a 5% chance, 6% chance of getting COVID. So it's best that you continue to wear your mask until we have enough herd immunity, until enough people in this country are vaccinated. We have some more longer term studies. But yes, you still have to wear your mask and keep your social distancing, wash your hands or use your sanitizer. And yeah,
Mm-hmm.
you'll have to wear your mask.
I also just wanted to add one thing too. You know, it's great that we're going to have more vaccines available once the Johnson & Johnson one comes out. But I also want to stress to people, if you have the opportunity to get vaccinated, you know, get vaccinated. We can't be picky. Okay, so no, right. I don't want this. I want that one. No, just get what you're able to get at that moment in time. And again, think bigger picture. Think, you know, we're, you know, working together to get out of this pandemic, and the sooner we can get the most people vaccinated, you know, that's when we're going to hopefully come out of this.
Yeah. Well, one of the things that I've explained to patients is that the vaccine protects you in the sense of it prevents it mounts an immune response so that the virus doesn't get a chance to replicate inside of your body. However, it's not a force field. It doesn't mean that you may not have viral particles in your respiratory tract. You may not have, you know, viral particles that you can cough or sneeze and thereby transmit it. We don't, you know, this is still a possibility. So for this reason, the social distancing, the barriers, the hand washing, all of this is still critical to stopping the spread in the community. So again, vaccinate to protect yourself, to not be a fountain of replication for the virus where it could spread further, but also keep your distance and stay away from everybody so that we can prevent that we can have that physical barrier also.
Yeah, so thank you so much, Dr. Espina, because that was another question about health educators. What messages should we be giving health educators across all systems and in public health as well? So those are great pieces. Another group that we think about are our kids, the children. When do you think we could give the vaccine to children?
There's still, you have to have more clinical trials involving children to test how effective it is it safe. So far, I don't want to misspeak, I think it is Pfizer is available for 16 and over, Moderna for 18 and over. So we are still, we still have to involve children in the clinical trials, but at this point, we are not, there's no vaccine for children. We have to make sure that it's safe and effective, and I think, they have a less difficult course of illness. But, it's a hard thing because your parents have to consent to letting you participate in a clinical trial for this medication. So some parents may be, it's okay for me, but I don't know if I want to live, we have to get the clinical trials. We have to make sure it's safe for the kids and collect the data.
Another question. So we have much work to do with the vaccine, especially with vaccine confidence and building that trust of the vaccine. So what can our community leaders do, such as our faith-based organization leaders, our gatekeepers of the community? What can they do to help us out with that? So Dr. Diaz?
Well, it would be great if the gatekeepers can, and the key players in the community can help us to set up, in the past, we've been able to have these little sort of meetings and conferences and meet at the senior citizen building, but where it's with the social distancing, it becomes a little more difficult, but that doesn't mean that we can't do anything. I actually have, one of my clients is a school. And so one of the things that I suggested was having a Zoom meeting, because the children are learning remotely with the parents, with the grandparents, with the family members, to talk to them about how we can give them some good information and sort of find out what's going on in their community, because we want all the kids to come back to school. Right now, we have about half of them coming to school and half of them are remote. So it would be great if we could, explain that to them and get them feeling better about themselves and get their children back to school. Mm-hmm. So that's one of the things I thought about doing since we can't meet in person.
That's great, Dr. Diaz. Dr. Perez, do you have anything to add about community leaders and on the ground?
I would say, just encouraging people to ask questions, right? So I think it starts from the top. If anybody has any hesitancy, kind of pointing them in the right direction to get that information to kind of answer their questions. Yeah. So if it's talking to their healthcare providers, if it's going on the CDC website, things like that. If they're not entirely sure about the right answers, but just, I guess, from a top level, making sure that we're pointing people in the right direction, whether it be their healthcare providers or, again, just staying away from misinformation and really encouraging people to be open and ask questions and just keep asking questions until, we can get everybody on track and on board.
Yeah, thank you. So I want to ask also Dr. Espina, in regards to your patients, so you see a wide variety of diverse patients. Tell me what they're saying. What hesitancy or issues do they have?
So, among the things that have come up, I've had patients, and again, the internet and my beloved colleague, Dr. Google, is filled with wonderful information, but filled with very bad information also, as Dr. Perez has pointed out. One of the things that has come up, people are asking, is it going to change your genetic makeup? And the answer is no. Not to go into more cell biology than you really want to, but the mRNA isn't going into the nucleus and changing your DNA. It's basically, think of it as a recipe to make a protein. And the way I always describe it to my patients is, imagine I'm the virus. I'm giving you the recipe to make this button on my white coat. Your immune system will see that, make antibodies against my button. And then when I finally show up and try to attack you, the minute I stick my foot inside of your bloodstream, it's going to see the button and it's going to attack me immediately before I can cause any problems. So it's not changing your genetic makeup. It's just literally the recipe to make a button is basically what it is. You know, I get questions about changing genetic makeup, which is no. I get questions about, you know, obviously is the interactions with the medications that we talked about earlier, which is also a no. I have questions, you know, people are very suspicious about, you know, government and all these different things. And at the end of the day, the most tragic part of this entire pandemic is that a very scientific question has been argued in a very political environment. Science is something that inherently seeks to prove itself wrong and is always working to find any weaknesses in its argument. We don't spin things. We tell you that, look, these are the probabilities, these are the statistics, and we're our own harshest critics. It's part of what makes science so beautiful, and it's almost its purity comes from that. That, you know, we're always searching to make sure we're not wrong. I can't stress enough to the patients that when I send you to get a vaccine, my greatest concern is that you don't have a side effect. I want to make sure that you're okay. I don't want to send you to something that's going to hurt you. That's not what I got into this work for. So, and that's myself, and that's Dr. Diaz and Dr. Perez and everybody, every nurse and every MA and all of us that are in this. We're in this to try to help people be better, feel better, not get sick, have a better life. And right now, the path to that is the mask, the vaccine, the social distancing, and hopefully by doing these sacrifices by next year-ish, we'll be more back to normal, you know. But these are the things that I run into with patients, that it's that fear of, I'm going to wait a little while longer to see what happens. Well, the longer you wait, the more probability we have of new strains popping up that will be more dangerous. So don't wait. Get it now, as soon as you can, because, you know, it's a race to see if we can get this thing controlled as quickly as possible.
Mm-hmm. Thank you.
And just to add to that, you know, I think, you know, throughout this pandemic, so I don't work in the hospital. I work, you know, in an outpatient, what we call outpatient setting. And I think, you know, one of the most frustrating things for me was, you know, speaking to patients who have COVID, and, you know, there's not a lot of stuff that we can offer to patients when they're home with COVID, right? It's, you know, symptomatic supportive care is what we call it. So, you know, fluids, rest, Tylenol, ibuprofen, and I feel like everybody at one point was asking for something. You know, they wanted medicine, and, you know, outpatient, we don't have a cure for COVID, but now we have something to prevent COVID, and you know, that's what we should all be jumping on board for. So I think, you know, if we can prevent it, this is something that, you know, we're excited about in the healthcare field, and we just have to, you know, keep communicating that this is proven to work, and they've done a lot of studies, a lot of good evidence-based studies, and this is what we need to make sure patients are understanding.
Well, thank you. Thank you for that. Dr. Diaz?
Hi, we have over 40 million Latinos in this country. We have to, it's a huge chunk, just Mexicans and Puerto Ricans. I mean, we have a huge population of Latinos in this country. If we can't get that large segment vaccinated, it's going to be very difficult to get herd immunity. It really is. We know that as a disadvantage that many Latinos have is that they live in congregate housing. They don't only have a nuclear family. They can't afford to live, you know, they have to live all together. Many of them are essential workers. And so they have to, you know, we want them to understand that they are critical to the entire country. they have a great role to play, a big part to play. And I think we have to change that messaging, and we have to get it through to everybody, not only Latinos, but non-Latinos. We're all in this together, really, and we have to. It's been very politicized, and that's been very painful because I'm a contact tracer. I'm a certified contact tracer, and I work for a health department. And it's really sad when people hang up the phone on you, they don't want to talk to you, or they give you the wrong number. But I found, by and large, when I speak to Latinos, they are so want so much knowledge. They're questioning, they're asking. They really want to know more about it, but unfortunately, by the time they speak to me, they already have COVID. So all I can tell them to do is how to prevent reinfection or how to prevent spreading it, and hope that they'll keep the quarantine, which is, as you know, why they brought down the quarantine time to about 7 to 10 days, because people can take time off from work. So that's another thing. If you get the vaccine, you probably won't get, you'll have extra protection against COVID, and you won't have to lose time from work. So there's many layers, but that's one of the things that I hope we can get together, that everybody understands how important it is for Latinos to be engaged and to get this vaccine, in addition to everybody else, but it would really help them immediately.
No, that's great, Dr. Diaz. And I think you being a woman of color, a Latina who speaks the language, I think we feel very comfortable with all of you speaking your language and understanding where they're from. So it definitely gives a comfort zone, comfort space. So kind of this drives me to the best practices. Each of you have brought so much to the table for COVID from day one. So just on testing, contact tracing, mitigation strategies. Can each of you tell me more about what you're doing in your practice, not just with the patient, but your office? What is your office doing to take care of these, patients? So, Dr. Perez, do you want to start?
Yeah, sure. So, I think right now we're at a point where we're trying to, we've kind of sent out mass text messages to our patients who are 65 and over and qualify to get vaccinated. And then I think individually, the providers here, as we see patients who then meet criteria, if they're between 18 and 65, if they have certain comorbidities and are eligible for the vaccine, we're trying to identify those and get them, scheduled or talking to them. I mean, not most people are, I'm in it. There's a few we have to, talk to and educate, and that takes a little bit of time. So I think as a provider, speaking to other providers, just, we're going to have to be really patient and just understand that some people are going to need a little bit more time in talking to. But I think that's where we're at right now at my office. I'm just trying to identify the patients. And then it's, the other things here too for us is, we're trying to still do primary care and then vaccinate. And so there's a bit of a slowdown. And so I think just overall, I know we're asking for a lot of patience from everyone. So the other thing that we're doing here that's really important, and I think it helps kind of ease people's, if they have fear or anxiety, is we do vaccinate and then we have them wait in our office for 15 minutes. So all day it's like timers going off because they each have a little timer that they hold. So I think that's important for people who've maybe had like an allergic reaction to something in the past. I get a lot of questions about that. Oh, I'm allergic to penicillin. Am I going to be okay? And just so people know, most places that are vaccinating have a lot of stuff on hand. So we're ready. We have the EpiPen, we have Benadryl. Everything is on hand in case something like that were to happen. And so far, nothing like that has happened in any of our sites. So watching patients and then just really trying to get mass messages out there for the people who we know qualify based on age. And now we're at a point where, just one-to-one during patient visits or kind of remembering patients like, oh, that person's eligible. They need to be in here right now and get their vaccine, and, bringing those patients in as we identify them.
That's great, Dr. Perez. Dr. Espina?
Mm-hmm. So, going back to something we were talking about earlier, that Dr. Perez was talking about getting people at the highest levels in society, our government leaders to get involved, which is critical. But the other thing is that in the time I've been in this practice, I've had the pleasure of kind of building up, kind of the families and who's cousin and all these people that are my patients. And what I found is that within our Latino community, we have our own little community organizers on the block. Yeah. And I have been sort of targeting them and, kind of, hey, did you get vaccinated yet? Hey, did you tell, Fulanita and Menganita to go get vaccinated also? And it's worked. They like to show off that, hey, I got the vaccine and I'm going to be okay. So I've been spending a lot of time reaching out to these patients that I know, not only do I owe them because they helped me, build up my practice by bringing their family members, which is beautiful, but also getting them involved in their own communities to say, hey, you know what, you got the vaccine and a lot of people listen to you. Why don't you show them that you got the vaccine? Your arm didn't fall off, right? So you're doing better, you're doing okay. And, it's actually paid off some dividends. And like Dr. Perez mentioned, the time. Office hours are running over pretty regularly. The phone's ringing off the hook. Taking the time to answer those questions and staying on the phone, and most of my patients have my cell phone number anyway, but it's all that communication that goes around. It's time consuming, sometimes exhausting, and repeating the same stupid story. The story about the button, I've said that one 87,000 times. I'm going to rip these buttons off and eat them one of these days. They're driving me crazy. But by getting that message out constantly, I think, at least in my little cohort, I'm seeing people convinced and going forward. And, and of course, me being me, I bust their chops a little bit afterwards when they come back and I go, so, you're still alive, huh? You got the vaccine and everything's okay. And they laugh and then they tell their family members. And you know what? That sort of community, we're all in this together, that message is critical. And I think the more that we do that, I think we'll have some success in this.
Yeah, thank you. Thank you. Dr. Diaz.
At the school, I consult with the school, and they constructed a healthcare suite. So I have 6-foot walls dividing each cubicle. I made 3 cubicles. I made up an isolation cart. We also divided the bathroom so that the students who were ill could have their own bathroom. And we have an air purifier, ventilation, and the window's always open, even if it's just a crack. The students they have to wear their masks all the time. If they don't fit right, we put a new mask on them. And the parents have my phone number. They have my cell phone number because they have questions. Many of them don't speak English. And some of them, unfortunately, have gotten COVID, the parents or the children. And we've had to figure out, are we going to shut the school down? Are we only going to get this class out? And because the children don't move around, they just stay in their classroom, eat lunch in their classroom, we've really been able to keep it down tremendously. And so more and more parents became more confident and started bringing their kids to school. But we designed a suite just so that children could be safe and they could be isolated from the other children if they're sick. And then I have a curtain that goes across so that it provides another barrier. So that's what I do. I make myself available to speak to anybody, anytime, and the teachers, of course, and the staff.
That's great. And I think all your messages, all that you are teaching us right now, that others adopt. Right now, we have such a small piece of Latinos taking the vaccine. So there's a lot of work that needs to be done here in New Jersey. And with what you're doing here, we can all learn from. So I so appreciate you guys for this. So I want to thank you, Dr. Espina, Dr. Perez, and Dr. Diaz for joining me tonight. I think you bring such a wealth of information to the department and to all healthcare providers in New Jersey and to our consumers and your patients. I bet your patients are incredibly appreciative of you, of what you do for them. But before we close, I definitely want to share our webpage, the Department of Health, and where to learn about the vaccine. If you go on to the COVID-19 Vaccine Hub, you can learn about our plan, who's eligible, and other pieces of the vaccine. So please visit us at covid19.nj.gov. COVID-19/vaccine. That's covid19.nj.gov/vaccine. Also, please remember to continue your safety behavior, safety practices, physical distancing of 6 feet apart, washing your hands frequently, wearing a mask. This will continue our protection for New Jersey. And lastly, if you're interested to get the vaccine, and which I hope everybody is, please seek medical advice. Do not turn to social media or other misinformation. It's really important that we have physicians who will care for you and want to give you accurate, reliable information. So just the final words again, thank you for watching, and please stay safe in New Jersey. Thank you.
Thank you.